When a crisis hits, we look for solutions and react to the challenge of the moment. In 2020, that's COVID-19. And as the world races to find a vaccine, the polio eradication infrastructure is playing a critical role in protecting communities from the pandemic. It might seem invisible, but it's a vast disease-fighting toolkit that surveils for traces of the polio virus and tests thousands of samples every year, and focuses critical resources through hubs and emergency operations centers, maintains a sophisticated logistics network to safely deliver vaccine, and trains health workers to inform the community of the importance of immunizing children. Now, Rotary and its partners are using this polio infrastructure to also help respond to the COVID-19 pandemic. Surveillance is a cornerstone of the polio eradication effort. In Ethiopia, community volunteers are now reporting suspected COVID-19 cases. And community health workers conduct house-to-house visits to identify suspected cases. Knowledge and information hubs like emergency operations centers are central to polio eradication activities in Pakistan, Afghanistan, and Nigeria. They are now also used as coordination centers for COVID-19 response, where polio partners develop plans, analyze data, and quickly share information, all in a centralized location. In Benin, teams created a national interactive dashboard, tracing contacts, mapping cases, and managing data. In Pakistan, Rotary's polio resource centers offer COVID-19 training for health workers, and one center serves as a testing site for the community. Across regions, the logistics network used to distribute polio vaccines is now essential in getting personal protective equipment to remote areas. In Pakistan, trained staff have collected thousands of COVID-19 samples. And teaming with UNICEF, Rotary distributed more than 3 million bars of soap to households in vulnerable areas of Afghanistan. Because good hygiene protects against polio and COVID-19. This infrastructure relies on the trusted voices of community influencers. The relationships they build ensure accurate health information protects the community against polio. In Afghanistan, 70,000 of them have been trained by the polio program. Now hundreds of thousands of households have access to critical polio and COVID-19 prevention information. Rotary and our partners built an infrastructure that is now addressing the largest public health crisis in a generation. We should be proud of this contribution. And eventually, when planes, boats, trains, and cars carry people around the world and viruses travel with them, this infrastructure will live on to tackle public health priorities and ensure a polio-free world. Your ongoing support for polio eradication will leave behind this everlasting legacy for decades to come.